Diabetes affects over 29 million people in the United States, which is almost 10% of the population. About 25% of people with diabetes do not know they have the disease.
If not controlled, diabetes can cause multiple complications and even death. But with the help of education, lifestyle changes, and medications, people with diabetes can learn to manage their condition, prevent complications, and live long, healthy lives.
Diabetes is a serious chronic disease that causes high blood sugar levels. Normally, most of the food we eat is turned into glucose, or sugar, then goes into the bloodstream. There, it circulates throughout the body and is used for energy. Blood sugar normally moves from the bloodstream to the cells of the body with the help of a hormone called insulin. Insulin is like the key that unlocks the door to allow the sugar to move into the cells of the body. In diabetes, the sugar isn't able to move normally from the bloodstream to the cells of the body, so blood sugar levels go up. The longer you have diabetes and the less controlled your blood sugar levels, the higher your risk of complications. Possible complications include nerve, eye, and kidney damage. Patients with diabetes are also at increased risk of strokes and heart attacks. These diabetes complications can be disabling or even life-threatening. Type 1 diabetes is usually diagnosed in children and young adults and has been called juvenile diabetes. In type 1 diabetes, the body does not produce insulin, so it lacks the key that allows blood sugar to enter cells. About 5 to 10% of people with diabetes have type 1 diabetes. Type 2 diabetes is the most common and makes up about 90 to 95% of cases. With type 2 diabetes, your body does not use insulin properly. So you make the key, but it doesn't quite fit into the lock. Being overweight, not getting enough exercise, and having a family history of type 2 diabetes are risk factors for developing this condition.
Understanding symptoms can lead to early diagnosis and treatment and a lifetime of better health. Classic symptoms of diabetes are increased thirst and urination. Other symptoms can be fatigue, weight loss, and blurred vision, as well as slow healing sores or frequent infections, and tingling hands and feet. If you're experiencing these symptoms, see your doctor. However, most people with diabetes have no symptoms at all and are diagnosed with routine blood tests.
People with type 1 diabetes must use insulin, given with multiple injections daily or with an insulin pump. For people with type 2 diabetes, there are more options. Some patients can manage their diabetes with healthy eating, exercise, and weight loss. There are also many different types of oral medications available. Many patients with type 2 diabetes ultimately need insulin to control their blood glucose levels and prevent complications.
Education is the most important factor in successfully managing your diabetes. Patients need to understand what the disease is, how diet and activity levels affect it, as well as how to check and interpret blood sugars, and how to take medications safely. People with diabetes should look for classes that are taught by expert staff who are certified diabetes educators and cover a variety of topics in diabetes care. Making a few lifestyle changes can dramatically lower your chances of developing type 2 diabetes. First, control your weight, and second, get moving. Both of these can cut your chances of getting type 2 diabetes. There are 4 dietary changes you can make to have a big impact on your risk for type 2 diabetes. 1, choose whole grains and whole grain products over highly processed carbohydrates. 2, skip the sugary drinks and choose water, coffee, or tea instead. 3, choose good fats like vegetable oils, nuts, and seeds. And 4, limit red meat and avoid processed meat. Choose more chicken and fish instead.
By making lifestyle changes and getting proper care, people with diabetes can lead active and healthy lives.